No, a vote is open. The next two senators will be Senator Murphy and Senator Murkowski. I hope to be back by the end of that.
Thank you very much, Madam Chair. Thank you to all of you for your service to this country during an incredibly trying time. I thought that Senator Collins' line of questioning deserved a follow-up. She asks a good question. She says we've got high vaccination rates in Maine, and so why do we still have so many deaths? But I think it's important to sort of step back and look at the national data here. I'll direct this to you, Dr. Walensky. I was looking at a survey of national data that was published now back in the spring, so it's a few months old. But in it, it suggested that if you look at the 10 states with the lowest rates of vaccination versus the 10 states with the highest rates of vaccination, it's black and white. You are 4 times more likely to be hospitalized if you live in one of those states with the lowest rates of vaccination. You are 5 times more likely to die if you live in those states. And so, each individual senator will have their own experience, but tell us what the story is now that we have lots of variation amongst states when it comes to vaccination rates, and what that tells us about your likelihood to ultimately end up in the hospital or end up dying from COVID.
Thank you for that question, Senator. So yes, we have about 75,000 cases a day right now, and there are states that are highly vaccinated, and they're still having cases, as Senator Collins has commented on. This is going to be very local, very community-based. This virus is an opportunist. It is rapidly transmissible, and if you have communities that are under-vaccinated, even if a state average is at 70%, this virus is going to go to those communities. Importantly, we have actually looked during the Delta surge at 3 states with high vaccination rates, Connecticut being one of them, and 3 states with lower vaccination rates. And we can see, even just in this Delta surge, just since June, that the death rates in the under-vaccinated states, in the states with vaccination rates that are 10, 20% lower than the highly vaccinated states, the death rates are 5 to 10-fold higher. So we absolutely can see the impact of this. There are cases that occur in vaccinated people. They, for the most part, don't lead to death. Sometimes they do, but for the most part, they don't. These vaccines are preventing disease. They are preventing 10-fold more likely to be hospitalized if you're unvaccinated versus vaccinated, 11-fold more likely to die if you're unvaccinated versus vaccinated.
I think Senator Collins' question was a good one, and I'm glad to get the true story of what the overall national data is here, because it's compelling. But there are other senators who are deliberately trading in just dangerously false information. It's stunning that the misinformation about COVID is not just coming from purveyors of propaganda online. It is often coming from our colleagues here in the Senate. I was on the floor a few weeks ago listening to Senator Johnson, who suggested pretty sort of transparently that there was a correlation between those who got vaccinated and post-vaccination deaths, noting that 5,000 deaths that were reported on the adverse event system happened 1 or 2 or 3 days following a vaccination, suggesting that there was a correlation. I'll ask this to Dr. Walensky. Is there any increased risk of death to individuals who get a vaccine? Is there any data to back up the claim that Senator Johnson was making, that there's some correlation between risk of death and vaccination? Isn't it exactly the opposite?
For COVID, it is, in fact, exactly the opposite. Our vaccine adverse event system collects all deaths after vaccination. That means if you were hit in a motor vehicle accident and succumbed to that event, that would be reported in our vaccine safety system. Clearly, that is not a causal effect from a vaccine. And yes, these vaccines are working to prevent death from COVID-19. And what I would just say, when people ask me all the time what they can do, what Congress can do, what senators can do for us as a country, for me at the CDC, it is to encourage your constituents to get vaccinated. Thank you.
One of the things I hope this committee will work on in the middle of this pandemic and following is health literacy, is helping Americans understand where good sources of medical information are and where the dark spots are, where you're listening to political actors who have their own agenda, not one based in science. And I think this is frankly a place where Republicans and Democrats can collaborate, because I think we have found a general lack of health literacy during this pandemic, but it was a problem that existed beforehand. And so while it pains me to know that some of our colleagues are the purveyors of this misinformation, it's a project that probably should be able to be bipartisan moving forward. I appreciate you all being here. Thank you, Mr. Chair.
Senator Romney.
Thank you, Mr. Chairman. Appreciate your service and